This video will demonstrate dried blood spotting process and technique. For detailed instructions, please see the POP Study Manual of Operating Procedures, or the MOP. Label the dried blood spot card with a pre-printed Global Trace barcode label. After inverting the EDTA tube, but before centrifugation, accurately measure an aliquot of blood from the PK blood sample for the dried blood spot. 30 microliters of blood is required per spot, and 2 blood spots should be spotted per card. To accurately measure an aliquot of blood, select a calibrated mechanical pipette capable of measuring 30 microliters or a capillary tube with a bulb assembly. Adjust the calibrated mechanical pipette to the desired volume, select the appropriate size pipette tip, depress the plunger to the first mark of resistance, not to the bottom, to expel the air. Submerge the pipette tip in the blood, not touching the bottom of the container if possible. Release the plunger, allowing the pipette to draw the appropriate volume. Hold the pipette tip over the DBS card, over the center of the circle to be spotted. Depress the pipette plunger to the bottom, expelling the entire volume onto the DBS card, being sure not to touch the tip of the pipette to the card surface. Allow the card to air dry in an open position with the flap open for at least 2 hours at room temperature. Place one card along with one blue desiccant pack and a humidity indicator card into a gas impermeable Ziploc bag and seal it. Please try to seal the bag so that the barcode and the humidity indicator are able to be read without opening the bag. This decreases the chances of exposure of humidity from the air. Store the entire mini kit at -20 degrees for up to 8 hours following collection if a -70-degree freezer is not accessible, and store finally at -70 degrees within 8 hours of collection.